My name is Eric Roth. I'm one of the emergency physicians here at St. John's. I started working here in July of last year, so coming up on almost 1 year of being here. I grew up in Bloomington, a suburb of the Twin Cities. I spent, my time through undergrad here in the Twin Cities, and then I spent a little bit of time in Colorado before starting medical school out in New Hampshire. A lot of reasons brought me back to the Twin Cities. Most of my family is here, my parents and aunts and uncles. My brother is in town still. I have a lot of friends from college and from high school still in town. I've always felt like Minnesota was a good place to live and raise a family, and I've got a family now and feel like I have a good neighborhood for my kids to grow up in and good schools to go to. A lot of great medicine here in the Twin Cities as well. The emergency medicine market is good, and felt like there are a lot of good job opportunities here coming back. Being a graduate from a residency training program in the Twin Cities, I had a chance to work in some of the different departments in the Twin Cities and knew a fair amount of the emergency department directors and other emergency physicians in the area, and I did have an opportunity to interview and get job offers from several different departments. I felt like Health East and St. John's in particular was a good fit for me. I really like the focus on patient-focused care, and I feel like the organization does a good job of taking care of their physicians and their patients, and just in general the values of Health East really aligned with my values, and I felt like it'd be a good fit, and it's turned out to be that way so far. We have a focus of interacting with patients that really lets them know that they're coming first. We try and do a really good job of always introducing ourselves and telling them what our role is and working collaboratively as a team, which I think is very important in the emergency department. And at the end of the day, I never feel like someone from the administration is telling me I have to do something a certain way or I have to do things faster or differently than I feel is the best way to do it for each individual patient. I had a lot of opportunities with other places, and I kind of knew other systems and knew people in other systems. And I think one of the big things that drew me to this emergency department is I like the potential and I like the momentum of where this emergency department in specific is going, not necessarily the whole Health East organization, but this department is going. And we've made a lot of changes in the last couple of years. We may have lost some physicians as a result of that, but I think we want the people that are looking forward to a better department in the future, and if you're interested in being a part of that, then this would be a good place for you.